All right, now I'm joined by Dr. Pierre and Suji from Willow Dental. Now, I wanted to get you guys on because, of course, most dentist offices are closed right now except for extreme circumstances. But what would entail extreme circumstances for people?
Well, as defined by thanks for the question, as defined by the College of Dental Surgeons working with Vancouver Coastal Health, emergency things would be things that are cellulitis, which is really acute infections, hemorrhaging, uncontrolled pain, and pain that we haven't been able to get rid of simply by prescribing pharmaceuticals. So if those situations happen, that would be considered emergency dental treatment.
Okay, because that's good for people to know, because I know some people are probably in a bit of a panic because there's other people out there probably going, well, my kid's braces need to be adjusted. Is that an emergency? Probably not, but there's probably questions like that.
What's also important for everyone to know, too, is that we do have a 24-hour call line where we can actually talk to people and work through how to manage their emergency and what they should do next, and also try to work with them to see at what level their pain gets to the point where we can place them. There are offices that are open, Curtis, but they're really restricted to real emergencies. So we'll work with people. If they're not sure, they should just call the emergency line, and we'll work with them. We're 24/7, and lots of calls coming in, and a lot of people were actually able to reassure that this is okay, what you've got is okay, here's what else you can do. And it's worked really well that way.
Yeah, because I can imagine people can call up that line and say, I've got a toothache, I can't seem to manage the pain, I've tried taking Tylenol. And you might say, well, have you tried Oragel, or have you tried rinsing with mouthwash and things like that? Right. That might be just enough to get them over that hump, right?
Yeah. And also, if there's a major accident, so a lot of young children actually fall and break things, they can text us photos, and we do have doctors on call that can look at it and phone them and discuss what needs to be done and what is the urgency. So there are things that we can do that can lay you over until you get back into your own dental office.
Now, if people need to get a hold of you on that 24/7 line again, what is the number?
It's 604-805-2500.
Okay, that's good to know, because I'm sure there are people out there with all kinds of questions.
Yeah.
And of course, another question they probably have right now is the offices that are open, that are seeing extreme cases. What kind of measures are they having to do right now to take patients?
We are following the protocols that are discussed with the College of Dental Surgeons, the BC Dental Association, as well as Vancouver Health. And we're following what's called PPE, which is personal protection equipment. So the offices that are open are following all the standards of care that have been published to the day to prevent cross-contamination, to keep the staff safe, the patients safe. Just a really good protocol.
That makes sense, because you're going to have to definitely take all those precautions right now to help curb this virus that's going around. Obviously, anything else we need to let people know before I let you go?
I guess stay safe, social distancing, and if you have any questions, we're there to help.
And again, what's that number again, Suji?
604-805-2500.
All right, guys, thanks for taking the time to chat today, and you stay safe.
Thank you. Thank you. Bye-bye now.